Check the chart for the physician's certification of the death of the patient. The physician is the only one who can declare if the patient is already dead. Ask permission and explain the procedure to the significant others in order to the significant others to know what are you going to perform. The cultural, religious, and age-related needs of the deceased patient and the family must be considered whenever delivering post-mortem care. It facilitates respect and the belief of the patient and family. Gather all needed equipment and supplies to perform the procedure to save time and energy. Ask the family if they wish to remain inside the room during the procedure in order for the family to decide and to spend more time with their loss. Provide privacy. In order not to expose the dramatic events of the patient. Pour lukewarm water into the basin to the bed bath of the deceased patient. Wash and dry your hands thoroughly before beginning procedure. Put on gloves when remove all the pillows except on which you will place under the head. Remove jewelry or any other personal items of the patient and give them to the significant other for legal purposes, and so you will not be charges of theft. Close patient's eyes. Put on any dentures if any, then close the patient's mouth. Closing the eyes of the deceased is a form of show respect and eternal rest. Dip washcloth in a basin with lukewarm water, then wrap it around your hand to form a mitten. Using a circular stroke, wet patient's forehead, eyes, cheeks, nose, mouth, and ears. Using the same technique, soap the areas mentioned, then wash with lukewarm water, still using the same technique. Start from the least contaminated area to the most contaminated area. Get cotton balls and put them on patient's closed eyes, in the nose, and the outer ear, then secure each with a tape lengthwise. Secure patient's jaw with a cravat. After 15-20 minutes, patient's jaw will open. Drape the patient with a blanket and remove the top sheet underneath to wrap the patient to be brought to the funeral home. Comb the hair of the patient. Remove patient's clothes carefully as to not expose any body part. You have to provide privacy and respect. Perform bed bath on the patient to prevent discoloration. Expose further the arm. Perform the same technique on this body part, then dry thoroughly to prevent spread of microorganisms. Expose the other arm. Do the same procedure. Using the same technique, wet soap and rinse the chest, abdomen, sides, and pelvis to clean all areas. Turn patients towards you. Place the towel lengthwise under the patient's back down to the buttocks. Wet soap and rinse back the buttocks thoroughly. Expose further leg, move the towel under it, wet soap and rinse thigh, leg, groins, and foot to clean the leg and prevent discoloration. Do the same thing to the leg nearer you. Finish the bath doing the same to the patient's genitalia. To clear from secretions, put on the draper, underwear, and patient new clothes. Remove bath blanket. Give family option to view or not to view patient and accompany them as they do so. Encourage the family to say goodbye. Do not rush the process. Apply name tags on the foot and on the hand. Cover and secure the patient with the shroud. Secure the shroud with safety pins. Secure another name tag on the shroud. Lastly, before transporting patient to the morgue or embalming or autopsy, make sure to pray for the soul of the patient.